Hi, Primas. I'm Roxy,
And I'm Giselle.
and this is the For Latinas podcast. Welcome back.
Welcome back, everyone.
Today's episode is similar to all of our other episodes where we talk about the things we were never taught but always needed to know.
It's all about women's health. And as a women's health nurse practitioner, I'm going there.
Giselle is answering the questions that feel too awkward, too taboo, too embarrassing to ask your doctor.
From our bodies to our cycles to the stuff we whisper about but never say out loud, no topic is off limits.
Because if you've ever thought, is it just me?
It's not. And we're going to talk about it today.
This is an important episode because oftentimes women are back channeling, we're Googling, we're trying to find answers to things. We're also getting bombarded on our algorithms about needing to get blood work and check our hormones. But how is that helping us learn more about our bodies? So I think today is an essential episode for all the girls.
I love it because this is my bread and butter. I do this every day. It's so true. There's always a new supplement or a new thing that people are trying to push on our socials that is like, is that really necessary?
There's often providers that are being paid or sponsored by other supplement companies. And when you see that as a provider, because you're obviously not sponsored and not in the influencer space, but should we trust these providers with these supplements that they're sponsoring?
If you were an OBGYN or some kind of midwife or WHMP that you would, whatever you get sponsored by, I really hope you believe in it. That's what I would hope, but yeah, I don't know at the same time.
Yeah. And so it's important, I guess, for our primas to be critical thinkers in this space and decide for themselves if they think that this is really a great option for them, their body. And do you recommend they should talk to their OB about whatever supplement they're taking?
Yeah, for sure, for sure.
Okay. So let's dive into the questions. The first one is really interesting. One question we got is, what do you think is an under-discussed topic in women's health?
Now they're becoming a little bit more popular. Hormone replacement therapy, women that are in perimenopause or menopause are like bringing it up more. Whereas before, people would hit menopause or be in perimenopause, and then everyone would just brush them off and just be like, well, it is what it is, and suffer through it basically until you don't have those symptoms anymore. But today's day and age, women are talking about it more. I think we should talk about it more. We should, as providers, offer solutions rather than just like being like, oh, it is what it is. You're in perimenopause.
Yeah. What is perimenopause? Because I am a 36-year-old woman. Am I perimenopausal? I'm seeing it online. I'm hearing conversations that it can start as early as 35.
So perimenopause is when your cycles start to become irregular and you're like leaning towards the menopausal. So to be menopausal, you have to be without a period for 12 months. And then you're considered menopausal. But before that happens, usually your periods get irregular. They start skipping like a month, skipping 2 months, skipping 3. And then when you're like in that area, you're perimenopausal. Um, your hormone labs may be normal, they may be abnormal. So usually when my patients come to me and they're like, I want to get lab work done to see if I'm perimenopausal, it may show that it's abnormal, but it may also be normal depending on where you are in your cycle. So I don't think that's the best way to determine, but just by like you telling me that like, okay, my periods are abnormal or this and that is happening, I can just be like, yeah, you're perimenopausal based on that. Also like during perimenopause, people will start having like symptoms like hot flashes, night sweats, mood irritability, things like that.
I've been seeing more increase in conversations about it on my social media.
Yeah.
And at the same time, I'm receiving information that more women in their late 30s and early 40s are pregnant.
Perimenopause, you could still get pregnant in your perimenopausal state. As long as you have a period, you can still get pregnant.
So use birth
So,
control or a form of birth control if you're having unprotected sex.
yeah, it's hard because it's hard for women who are not who are perimenopausal because obviously their cycle isn't regular. So you may think like, "Oh, I'm going through menopause, I can't get pregnant," but you can still get pregnant.
All right. Thanks, Giselle. That's informative for us all. We have a prima who is a mom who reached out and said, "Is getting air in your vagina natural? I think the doctor closed me up weird post having a baby, or my vagina dropped when I gave birth, but sometimes I get bubbles up there, and sometimes when I fart, it wants to go up there too."
So I feel like this is relatable to a lot of primas. Uh, but, long story short, yes, it is normal, especially after having a vaginal delivery. It's AKA queefing. But it stems from your pelvic floor muscles being weak, essentially. So
And
pelvic floor therapy.
does this happen to women who also don't have babies? Because you know,
Yeah, it can happen, yeah. I mean, there are different ways in which your pelvic floor muscle can weaken without having babies. So there's other ways in which your pelvic muscle can weaken besides having children. If you've never had children, like having high BMI can also weaken the pelvic floor muscles, causing air to get trapped in during movements, sex, anything like that. So no, your doctor didn't close you wrong, and your vagina didn't drop. I think that's what she said, right?
yeah.
Yeah, no, that's not what happened. But pelvic floor therapy, I
Can
think
your vagina does your vagina change after you've had a baby from being stitched?
your whole body changes after having a baby, of course, like, it's not gonna be the same, but at the same time, like, when I see my patients come back postpartum and not like 90%, I wanna say, maybe like 80 to 90% of patients always tear and always get repaired, but then when I'm examining them postpartum, I'm like, "This is the same." Like, you can't even tell.
That's great news.
Yeah.
Great news for all the mothers, the expecting mothers, the ladies thinking about potentially having a baby. From a personal perspective, you go through this period of time where nothing's ever going to go back to normal, and then it does, and then a year goes by, 2 years go by, and you're like, "Wow, I feel great," you know?
Yeah.
So it does get better for new moms out
I
there.
will say, like, visually, it looks the same.
Good. Good to know.
Like, I don't know if it feels the same, but it looks the same for sure.
Another prima asked, "What is discharge and why do I have so much come out after my period ends?"
Great question. Discharge is your vagina's self-cleaning system. So the vagina is gonna self-clean on the pH scale, be acidic, basic. Your vagina's acidic. It's always gonna try to clean itself and go back to its acidic form because that's where it likes to be. It's basically just like healthy bacteria, mucus, cells, stuff like that. That's basically discharge. And it's like its cleaning method. After your period, your estrogen rises, which causes the cervical mucus to increase. So you may have more discharge after your period. And that's normal. That means your hormones are functioning as they should. It's not an infection. Discharge is healthy. You want to have discharge.
When should someone be worried about their discharge or potentially go see a doctor?
So if it ever changes in odor, if it ever changes in color, like green, gray, or if it starts to look like cottage cheese, definitely go to your doctor. Or if it ever is associated with like itchy, if you start getting really itchy.
This is one of those topics that we need to talk about with young women as well. I remember being young and feeling extremely embarrassed and not knowing what was happening to me, especially after being like having a whole beach day. Because as a little girl, you can spend the whole day at the beach and you're probably okay, but you don't want to have a wet bathing suit, period, on for many hours after you've been already wet. So, I think this is such an important topic to talk about and to continue to socialize among not just our age group, but also the younger age groups. That discharge is normal. It's nothing to be ashamed about.
Yeah, that's so true. Going to the GYN is, like, not a comfortable experience anyways, but I feel like with my younger girls, they're always, like, super embarrassed, but it's completely normal. Also, in pregnancy, you're gonna have more discharge.
Mm.
You're gonna have more because you're making a baby, the baby's cells are shedding, and they're coming out, and it's discharge, and it's completely normal.
Another prima asked, I don't know if it's in my head or not, but I feel like when I'm eating bad foods, my discharge smells different. So does food affect discharge?
You're not imagining this. Yes, food can affect your discharge smell, the odor. Your diet can affect your vaginal pH, the odor, and the bacterial balance. So, like a lot of foods with high sugar, foods that are super processed, alcohol, are being dehydrated.
Mm.
So, yeah, you're not imagining that. You're very in tune. You're a prima who's very in tune with her body.
Well, good to know. I feel like it's great to know that these things are healthy, that they're normal, that we're not imagining things. I we often forget as women that we live in our bodies and we always know when something is wrong or we always know when something feels off. And definitely trust your intuition and trust yourself and go see your OB if you feel that your discharge is weird, that you're not sure, that you're feeling uncomfortable. I think it's always a good first step. Would you agree?
Yeah, yeah. Trusting your intuition for sure, for sure. Um, and then I just hope you have a provider who also trusts you.
That's a great transition question. What do you recommend? Let's say somebody has gone to an OB, they had sort of a weird or bad experience, they felt uncomfortable. How do you recommend primas go about finding an OB they feel safe with?
You could use an app like ZocDoc. A lot of people write all their reviews on there. Lately, did see on TikTok that people are talking about leaving Google reviews. So you can check Google reviews. But it's hard and it might take some shopping around, I feel.
Yeah, I would recommend looking until you find the doctor that feels right. I was telling Giselle, I just went for my annual check-in with my OB, and I feel so comfortable with her that I get there, and it's like I just start crying sometimes because I'm overwhelmed or because it's a space where I can be vulnerable, and it's important to be vulnerable with our practitioners and our doctors, not just your OB, but your PCP, and talk to them about the things that are giving you anxiety, about the things that you're Googling, about the things that you're reading online that you're stressed out about instead of going based on all the things that you've researched online, have a conversation and find a doctor that will be on the same page with you and help you get the answers you're looking for.
Yeah, I literally always tell my patients, like, if they come in and they're like, "Well, I wanna do this, this, and that." And anyways, the conversation will lead to like, "Oh, well, I saw a video about it." I would be like, "Just tell me what you saw, like, let's talk about it." I'm always like, "Please tell me what you're seeing online because I wanna know, like, what are people saying online and how much of it is true and how much of it is not true."
Yeah, yeah. And also, like, what are you trying to get out of the information?
Mhm.
I think, like, seeing, oh, there's all these companies now where you can get a female hormone panel. Great, but what are you trying to accomplish when you get that hormone panel? Like,
Mhm.
are you trying to identify something is wrong with you? Again, like, is your body telling you something is wrong with you, or do you just want information to have information?
Mhm. Yeah, totally, and I definitely suggest that, like, if something's wrong or whatever, I'm like, "Okay, like, do you wanna just know what's going on, or do we wanna do something about it? Because we can talk about, like, the next steps, or I can just call you with the results, and you don't have to come back if you just wanna know what's going on."
Yeah. I think women right now are trying to be preventative, and a lot of our care doesn't push preventative care. So I
Mhm.
guess as an OB, how do you work with your patients to make sure that you're addressing these preventative care options through blood work or through annual checkups? What does that look like? be.
Yeah, I mean, it's hard too because my patient population have really hard social determinants of health, so it's hard for them to show up to their appointments or keep their appointments, but, um, it's definitely showing up to your annuals, and then my routine blood work is nothing crazy, like, I don't really run hormone panels or anything unless you're telling me something's wrong. Um, but I think just, like, showing up for your annuals, and even if it's not time to do a cervical cancer screening, because that's every 3 to 5 years if everything's been normal. But so it might not be time, but we can still talk about things that are happening. Because like, a lot of times I think people think things are normal, and they're just like, "Oh," and then I ask about it, and then that's what prompts you to tell me about it, even though you think it's normal, and then I'm like, "Well, wait a minute, that's not normal. Like, we should investigate that."
Yeah. So finding an OB you can be vulnerable with, and then they can help you based on how you're feeling or what you identify. Um,
Mhm.
shall we do another question?
Okay, let's see.
This is also, I think, going back to discharge. There's a lot of questions
There was
about
a
discharge.
lot of questions
We
about
need to
this
talk
chart.
about discharge more. It's like common. Everybody has it. Um, is there anything that I can do to improve the bacteria or the flora of my vagina? The same way we take probiotics for our general gut health.
Yeah, for sure. So there are vaginal probiotics that you can take. Any supplement or probiotic or anything that you're gonna start, I always say you need to do 3 months of consistent taking it in order to see any kind of improvements. So, do that. But yes, you can take vaginal probiotics. That will definitely help with the good bacteria. Because what happens a lot of times, especially with like BV, is that, and anything can trigger BV, literally like anything, like your underwear can trigger BV,
What is
cotton underwear.
BV?
Oh, sorry, bacterial vaginosis, which is basically just a disruption in your good bacteria and bad bacteria in your vaginal like microbiome. So like, yeah, like underwear, polyester, things like that, like, and literally anything, intercourse, your period, any of that can trigger that. Some people have chronic BV because they get it after their period every time, or they get it after intercourse every time, and it's like, but anyways, so vaginal probiotics is a good way. Anything that's gonna help your vagina get back to its normal habitat of aesthetic life. Oh my
Yeah,
god, is TikTok telling people to put yogurt in their vagina?
I don't know. Is that a thing that
Don't
people
do
are
that if they're telling you to do that. Oh my god, I also had a case where my poor patient, she was a regular for BV for me, and she was doing too much. So she was taking all these different vaginal probiotics and doing like boric acid pills. And so she basically killed off all her bacteria, even the good bacteria, causing her vaginal irritation. So then I was like, okay, we're stopping everything. There is too much you could do. Just pick one vaginal probiotic and stick with it. That's it. You don't need to take 3 vaginal probiotics.
and is a vaginal probiotic typically inserted through the vagina, or is it a pill that you take orally?
It's a pill that you
Okay,
take. Yeah. But the boric acid pills are vaginal suppositories. Do not ingest boric acid pills. You will
good to know.
die.
Um, one thing that I have been seeing on TikTok is providers talking about topical
Sorry, what'd you say?
estrogen cream, and putting like every woman after 40 should start using
Mm,
topical estrogen cream.
mhm.
Um, what is your take on that?
So, yeah, that's the perimenopausal hormone replacement therapy that there's more research and evidence to suggest that we should start hormone replacement therapy. I mean, so it's not I don't like, it's not like an age, but it's just, like, as soon as you start perimenopause, that's when you should start hormone replacement therapy and not wait until you're menopausal to start it. Just because for women, estrogen is literally everything. Our brain cognitive function uses estrogen, our heart health uses estrogen, our bones use estrogen. So, there's more research being done now because of course, we have no research on women, but
I
the
always
research.
joke that if I told you this, but I always joke that if men had babies by now, you would go to sleep, wake up, vagina would not hurt, nothing would happen, you'd have a healthy baby, and you would just like birth would be no
So
big
true.
deal.
Yeah, for sure, for sure, for sure.
But yeah,
Um,
there is limited information on women's health. One of
mhm,
the scariest things that I've realized lately, and not lately, I mean in the last maybe 5 years, but that, our tampons and our pads are bleached. I feel like that was a
mhm,
crazy finding, and as a woman who had fibroids removed from my uterus via myomectomy, I found it so incredibly disturbing that we don't just use cotton. Like, why can't we just use
mhm.
cotton pads?
I
And
don't.
now, like, the cotton pads, it's, like, cotton-lined pads. They're
Mm,
not completely cotton. You have to, like, pay an arm and a leg to get
mm,
cotton
mm.
pad.
I don't know, that has to be, like, an industry thing.
Totally. Totally, but, like, then it makes me spiral, and I don't know if other primas have had this where you have, like, a fibroid or you have endometriosis or
Mm,
you're in a constant state of discomfort or pain, and you're like, "Was it the tampons? Like,
mm.
have I been just absorbing these, like, bleachy tampons since I was 16, 17 years old?
Well,
What the
I would not think to link them to that, but I would be skeptical of it linking it to a type of cancer, like uterine cancer or ovarian cancer.
Mhm. What do you recommend for women period care? Do you have,
Mm,
is the cup recommended?
mm. As long as it's BPA free. Yeah, I mean, like, honestly, 100% cotton if you can, if that's in your lifestyle to do that, then that is, like, 100%, the way to go. The cup, the disc, all those things are good. Even period panties if it's, like, for you.
I
Whatever's
love period
comfortable
pan
for you.
I love
Yeah.
period clothes. I'm such a fan. I've heard that, like, the Thinx ones, which were, like, the
Mm,
first ones that came out, I bought a bunch of them because I hate wearing anything, but I also don't wanna have a pad on, and they
mhm,
absorb a lot. They absorb a
mhm.
full first day, second day period of
Oh,
someone who
wow.
has a heavy period. Um But now I'm hearing that there's, like, chemicals, and I'm like, everything
I
just, like,
know, everything
it's
has
ruin
chemicals.
everything. We can't have anything. Can't have
Yeah, as
anything.
long as you're, like, routinely changing out whatever method you're using, then that's fine.
Um,
But the Always pads were linked to UTIs and
yeah,
all these
don't use
things.
always. Don't use always. I feel like I'm not a doctor, I'm not a professional. As your prima, as a friend, don't use
So
always.
he's Always.
I like
No,
the
for
Cora brand. I think Cora has
oh,
uh,
yeah, I think I use that brand too.
good material.
Um, I tried the cup and it was not for me, Primas, let me tell you.
I remember
It was crazy. I almost had to go to the hospital.
I know, people lose it, and you can't find it, and you're like, "What is happening?"
So it was not for me, it was not for me, but if it's for you,
Few
then
friends
cool.
that swear by it, gives me cramps. It gives me more
Mm,
cramps. I don't know
yeah.
if it's, like, suctioned up there and
Yeah, 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 if it goes to like, towards your cervix and it's irritating your cervix, it could totally be causing you cramps, yeah.
mm, yeah, so it caused me cramps, but I don't like that I had single-use ones because I just try
Oh,
not to waste as much,
I
but
didn't even know they had that.
no, for the disc, I
Yeah, I
tried
didn't know they had that.
oh, yeah. I
Mm,
loved the disc. It was really comfortable. It stayed. There was no leaking. But I just didn't like that it was so single use and it's like this little
mhm.
plastic circle with like
Yeah. I
Plastic.
thought that those were reusable.
Maybe there are reusable ones. Okay, I need to do my research. But I liked it a lot, so a
Okay,
lot more.
I have friends that use it and they like it better than the cup.
Mm, yeah, it's good. Um,
After doing the cup, I will not be doing the disc.
okay, questions about fibroids. So, what do you do if you have fibroids in your uterus? And if you get them removed, can they come back?
Fibroids are benign muscle growths in the uterus. So benign meaning they're not cancerous. And they're extremely common. There's different types based on the location of the fibroids. Um, they are gonna grow with hormones and blood supply. So basically, like every time you get your period, like they're gonna grow. Um, they can come back after you remove them. Nor
So,
typically
why would you get it removed?
fibroids are I call them pesky little things that they irritate your uterus, so when you're on your period, it's gonna be heavier, it's gonna be crampier, so people will get them removed because their life is miserable, their periods are miserable with fibroids, it's just not a way of life. Of course, if you have a super fast-growing fibroid, it could be a red flag, but they're normally not fast-growing, but the more they grow, the crampier you're gonna be and the more blood you're gonna have on your period, like, the heavier your periods are gonna be. Um, we they usually don't remove them unless they're 5 centimeters or greater, but then I guess, like, it just depends on what you would wanna do about it. With these are one of the things that when my patients have fibroids or they think they have fibroids and we do an ultrasound, I'm like, "Okay, what do we wanna do about the fibroids?" Because going under surgery is the whole thing. Especially if it's, like, less than 5 centimeters, what do you wanna do? And unfortunately, a lot of the treatment for fibroids is to get on birth control because it's just to try to stop your cycles and try to stop the hormone that's feeding the fibroid. So let's say if you had a fibroid removed already, they can come back. It depends on where the fibroid was, but a lot of times they are in the wall of your uterus, so that's like the roots of it. You can't really get all the roots of it off, so then it's still there at a cellular level where it can just can grow back. Mhm.
That's pretty bleak.
Another thing about fibroids is that a lot of times it's just genetic, and also getting pregnant and having babies is also a risk factor of getting fibroids.
Mm. And have you seen patients that are pregnant and have fibroids?
Yes, yes. Pretty big ones too.
And so what do they feel like? Do they feel any different? Is it like having multiple babies in your belly? Like, how does
I
that
feel like
work?
my patients who have had them don't feel any different, but it does put you at a higher risk of hemorrhaging postpartum. That's for sure. Mhm,
Interesting.
mhm.
So it's a case by case basis is what I'm hearing.
Yes, case by case, and there's definitely doctors who specialize in fibroids and fibroid removals because it's such a big thing.
Our last question here is around painful sex.
Mm.
So what do I do about painful sex basically is the question. Is this common?
Yes, I feel like it's super common, and a lot of people will have appointments to talk about painful sex. There's always 2 questions that I always ask. A, is it upon insertion? Or B, is it deep penetration? Where is the pain? And then we can go from there. Because a lot of times, if it's upon insertion, then maybe you're having some kind of BV that is inflammate your vaginal tissues are inflamed, and anything that goes in there, like a tampon, is causing you pain. You can have a super strong pelvic floor too. Like a lot of athletes' pelvic floor are super strong, so then making it super tight and it's super painful. Things like that. Vaginal dryness also can make sex very painful. And then if it's deeper, then it could be like you have a fibroid or something else is going on that is getting, you know, hit, I guess, and it's causing you to have like a lot of pain and cramping even. after intercourse. But yeah, it's very common.
Interesting. So you don't have to live this way. You
You don't
should
have to
go to
live this way.
a doctor.
Yeah, if it's a problem for you, it's a problem for me. A lot of patients are like, "I have low libido, but, like, whatever." And I'm like, "Well, is it, like, problem? Do you not wanna have that anymore? Like, because if it's a problem for you, then it's a problem for me, and we can fix it."
I wish I lived close to you because you would just be my OB. I'm like feeling so comfortable. Your patients are so lucky to have you. I feel like you create such a comfortable space for them to ask questions.
Yeah, for sure.
Well, thank you so much, Giselle. Any last words for our primas?
Keep up with your annuals, keep up with your preventative measures, find a provider that you trust, ask the questions, or just ask us the questions. We'll take all the questions.
Primas, if you didn't get a chance to ask a question or you want to continue the conversation, you can always DM us on TikTok, on Instagram, or you can email us at forlasprimas@gmail.com. We are available to you, and we want to make sure that this is a space where we can talk about all things, including your physical and vaginal health. So, thank you so much for listening, and we'll see you next time.
Bye.